Does your thumb hurt at this exact location? Did you do the Finkelstein's test and it hurt like crazy? Do you feel a sharp pain in the tendon of your anatomical snuffbox whenever you try to grip, pinch, use scissors, or pick up anything with your hand? You probably figured out you have Quervain Tenosynovitis, and that's why you're watching this video. In this video, I'm going to show you all the advice and exercises that I found by watching these 9 different YouTube channels. To summarize all the tips and exercises these doctors, physical therapists, and physiotherapists have mentioned, I have a list here. There are generally 5 major categories of advice or exercise types that have been mentioned. There is cryotherapy, or use of ice packs, activity modification, or avoiding the use of the thumb, and splinting the hand, massage techniques, stretching exercises, and strengthening exercises. I have listed these 5 major categories in order of recency of injury, from the acute phase when you just got injured to subacute or intermediate phase, which is 3 to 4 weeks out, to chronic or late phase, which is more than 2 months out. Ice, activity modification, and massaging are the only things you should be doing in the acute phase. The only exception is wrist flexion and wrist extension stretches, because those stretches don't really directly stress or injure tendons. Massaging and stretching are what consists of the subacute or intermediate phase. Stretching and strengthening are the main parts of the chronic or late phase. Before we get into the exercises, I think it's important to talk about exactly where you are in terms of the injury, whether it's acute, subacute, or chronic phases. I know I classified them by the number of weeks or months earlier, but I think it's important to mention that I believe as a physical therapist that if you don't have full active range of motion of your thumb, you are still in the subacute or intermediate phase and should not be doing resisted thumb strengthening with things like weights or rubber bands. Category 1, cryotherapy or icing. 3 of the 9 channels recommended the use of ice for this injury: Bob and Brett, Floor Therapy, and Form. When you first hurt your thumb, ice is very important to decrease inflammation and to numb the pain. You can use the ice pack or a bag of frozen vegetables. Put a contact layer between the ice pack and your skin and let it sit for 15 to 20 minutes. To be honest, I didn't think icing was a huge deal in the beginning. I learned from personal experience that if you did any physical therapy treatment and exercises and you don't ice afterwards, it feels much worse the next day. My theory is that massaging and stretching the thumb or wrist actually irritates the injured tendon to a certain extent. This causes some degree of swelling. That swelling actually gets trapped in the wrist joint, and unless you ice it, that swelling stays in the wrist and causes unnecessary pain and stiffness. Now you might ask, what about heat? Here's my opinion. When you get to the point where you wake up in the morning and your hand is in severe pain, you actually should heat it up with a heating pad or run under warm running water. Personally, I do both. I put my hand in an electric heating pad by my bed, and then I go to the sink and run the hot water until it's hot enough. When the water is ready, then run my hand under the warm water. I then move my wrist around to loosen it up, and I move my thumb around. I also do a little massaging here. You can also do all this while you're taking a hot shower. After you warm up your wrist, you can do your physical therapy exercises. After you do your physical therapy exercises, then you ice the wrist. Category 2, activity modification. 3 of the 9 channels suggest activity modification: Bob and Brett, Floor Therapy, and Woodbine Physiotherapy. Don't pick up anything with your injured hand. A lot of us can't help using our dominant hand for everything, so that's where splints come in. You need a splint that immobilizes your thumb and wrist. You need to do this modification for at least a month. Please don't let us say modification, not splinting. You need to do activity modification for a month, but you should not wear your splint 24/7, 7 days a week for a whole month. If you do that, you will make your wrist stiff, decrease the blood flow to your hand, and that will slow your recovery. You will have to take off your splint every hour to move your wrist around and massage your wrist and hand. Category 3, massaging. This is the only category that is present in all three phases of the rehab: acute, subacute, and chronic. Massaging decreases stiffness, gets rid of scar tissue, increases blood flow, increases healing rate, and decreases pain if you do it right. 5 of the 9 YouTube channels recommend massaging: Bob and Brett, Strength and You, Woodbine Physiotherapy, Mr. Physio, and Matt Stefano. All of them recommended cross-fiber friction massage or Chris friction massage. 2 of them also recommended massage plus activation or functional mobilization. It is worth noting that Mr. Physio mentioned that you should not be massaging the tendon area of the injured tendon, especially near the radial styloid. I made the mistake of doing this and got a bruise, which took a few days to clear up. Category 4, stretching. 7 of the 9 channels recommended stretching: Bob and Brett as Dr. Joe, Floor Therapy, Woodbine Physiotherapy, Linda Hand Surgery Associates, Form, and Mr. Physio. 4 of the 7 of these recommended wrist flexion and wrist extension stretches as Dr. Joe, Floor Therapy, Woodbine Physiotherapy, and Form. These stretches do not directly stress the injured abductor pollicis tendons, so they can be done in the acute phase as well, as long as you're careful, as well as the subacute and chronic phases. All 7 channels recommended some form of stretching for the injured tendon, which should only be done in the subacute or chronic phase. I made the mistake of stretching my injured tendon in the acute phase, which made my injury worse and my recovery much longer than necessary. The recommended stretch time is about 30-second hold, 2 to 3 sets. You don't have to do 30 seconds if you cannot tolerate it. You can start off with just a couple of seconds and rest, a couple of seconds and relax. Category 5, strengthening. 7 out of the 9 channels recommended strengthening: Bob and Brett as Dr. Joe, Strength and You, Woodbine Physiotherapy, Orlando Hand Surgery Associates, Mr. Physio, and Matt Stefano. 4 of the 7 of these recommended using a weight like a dumbbell or a soup can for wrist strengthening. 5 of the 9 channels recommended use of a rubber band for thumb strengthening. 5 of the 9 channels recommended eccentric strengthening of the injured tendon. Bob and Brad and Dr. Joe recommended a use of a weight like a dumbbell or soup can for eccentric strengthening of the wrist. Strength and You recommended the use of a rubber band for eccentric strengthening of the thumb, and Mr. Physio and Matt Stefano recommended manual resistance for eccentric strengthening of the thumb. Out of these 5 channels, only Bob and Brett demonstrated in eccentric strengthening with the wrist supported and blocked by a table. Even then, they only demonstrated eccentric strengthening of the wrist, radial deviation tendons, and not the abductor pollicis longus tendon specifically. After trying the manual resisted eccentric strengthening technique by Mr. Physio and Matt Stefano, I must say that it worked great for pain relief, but it strengthens the thumb in a limited range of motion. The reason for this is pretty simple. It is not possible to strengthen the thumb eccentrically toward the full range if the thumb is too weak to reach full range in the first place. The thumb would simply collapse under its own weight before you can even apply resistance for this exercise. Aside from the 5 categories, there is one particular technique that stood out from the rest, and this is the on and off technique mentioned by Bob and Brett, which they claim to be invented by Robert McKenzie. In fact, of the 3 YouTube videos Bob and Brett made for Quervain rehabilitation, 2 of the 3 are about this on and off technique. They mentioned the Robert McKenzie book in their 2016 video. It is called The Human Extremities, Mechanical Diagnosis and Therapy. This book was written in the year 2000. This book is 22 years old. I bought the book myself to check it out. I flipped to the chapter that went over how to treat Quervain. It was mentioned in chapter 10, Common Disorders. The Quervain portion took up just 3 pages, and the first page it wrote Tenosynovitis, Quervain syndrome, quote unquote, trigger finger. This was a little confusing because I know that trigger finger is not the same thing as Quervain syndrome. After reading through the 4 pages, I found that Quervain syndrome took up 3 pages, and then trigger finger took up half a page at the end. Anyways, Bob and Brad demonstrated the on and off technique according to the book pretty accurately. However, as a patient who has this injury and actually tried this technique, I find it to be a little bit lacking. I think the concept of the technique by putting pressure on the injured tendon with the other hand is actually good because it provides a point of mobilization while the tendon moves from the active range of motion of the thumb. However, I believe the direction of the pressure as depicted by the book as well as Bob and Brad is not the best. Both the book and the Bob and Brad pointed the pressure thumb toward the tip of the affected thumb. I feel like having the pressure point in this direction ends up providing unnecessary resistance to the abduction movement of the thumb and could easily limit the range of motion during this exercise. And as a patient myself, I could testify that while having this injury, it is likely that the patient does not have full range of motion of the thumb due to pain and weakness. If you use this on and off technique as it is, you end up strengthening the thumb while restricting its range of motion at the same time. You might say, well, the purpose of this technique is not really to strengthen the thumb, it's to get rid of scar tissue. Well, unfortunately, because you are putting pressure against the movement of abduction, you are still strengthening the thumb, whether you like it or not, because you're providing resistance against the movement. I have a suggestion, and that is to change the direction of the pressure from pointing toward the tip of the affected thumb, which is a vertical direction, to a horizontal direction toward the palmar side of the wrist. This way, it won't limit the abduction range of motion of the thumb as much. After doing all this research and having tried all these exercises myself, I found that the subacute and intermediate phase of the rehab is the longest. According to the available resources, the only things that we can do during this phase appropriately is ice, heat, massage, and stretch. However, I was able to come out with 3 more exercises that were not mentioned and are still safe for rehabilitation. The first is tapping. This is a neuromuscular re-education technique commonly used in desensitization therapy. This is good for 2 things: desensitization of the painful tendon as well as stimulation of blood flow to the injured tendon. The second exercise is brushing, which is also a desensitization technique. I use this in conjunction with the on and off technique from Bob and Brad, but by itself it is still very effective for pain relief because it's desensitizing. The third exercise is an active range of motion of abducting the thumb by contracting the Abductor Pollicis Brevis. This was a bit painful in the beginning, but it was bearable while combined with the brushing technique. The exercise is actually safe because the injured tendon is the Abductor Pollicis longus. Abductor Pollicis Brevis may be slightly affected, but not to the same extent. I had a lot of fun making this video. If you liked the video, please give it a thumbs up.